On the line. Welcome to chat night. We bring you good vibe. We shine on the line. We all over the world. Chat night Africa. We all over the world. Chat night Africa. Welcome to chat night. We bring you good vibe. We shine on the line. Welcome to chat night. We bring you good vibe. We shine on the line. We all over the world. Chat night Africa. We all over the world. Chat night Africa. Welcome to Chat night, the only place that we give you good vibes. Chat night Africa. Welcome to Chat night, all over the world we are shining the light. Chat night Africa. Welcome to Chat night.
Hello everyone, welcome to this week's edition of Healthline on Chat Night Africa. My name is Divine Nche. I know what it feels like not to be able to get up from bed, even leave your bedroom and go to work because of illness, and for many months. Ugly, especially because you have a family to feed and the bills don't stop coming. Ladies and gentlemen, I don't want you to go down that path. It is very, very ugly. But what if I could bring you a world-class expert who has information that prevents you from sliding down that road? The torments of illnesses are enormous. Well, you are about to meet one. As I said, he is a world-class cardiothoracic surgeon, and he is coming with massive firepower. Professor Nche Abegly Zama is the one I'm talking about. He has been practicing medicine for God knows how long, and I can tell you that Professor Zama has cut through hearts, complicated surgeries around the world, some for free. He is my guest on Healthline this week. He will be talking about those heroes in your body fighting for you every day. Ladies and gentlemen, join me now in welcoming Professor Nche Abegly Zama on the platform. Doctor, thank you so much for accepting yet another invitation to Chat Night Africa. You are on Healthline.
Thank you. I'm glad to be here. You're so kind to have invited me. It's my second visit to your show. And I'm glad to be able to chat about things that, especially the immune system, that has a lot of relevance to everyone out there.
Professor Zama, if people knew about their body military, the immune system, and took action to build and or maintain it, would that prevent them from going to the hospital or from falling ill?
Yes, to a large extent, because this system was designed to protect us from extrinsic attacks. And I'm talking about viruses, bacteria, parasites, and even cancer. And also, this is a system that was designed to help us heal after an injury.
So what should people understand the immune system to mean?
Well, the immune system really it's a complex biological system that is set up in the body, and it involves the entire body, and it involves different factions that work collectively to protect you from illnesses that can be caused by either foreign invaders. I'm talking about germs, bacteria, viruses, and whatnot. So these are it's defined as a system, so it has various parts, and each part has responsibilities, and then collectively they can actually realize the ultimate goal, which is to keep you in good physical shapes and protect your organs so they can do their job and do it well.
You are watching Halfline on Chat Night Africa. Dr. Zama, without taking us to Harvard Medical School, tell us a little bit, how does your immune system, described as your body's military, how does it fight off illnesses? How does it keep you from falling ill?
So it's a very good question, Divine. And I've used this analogy multiple times. And most recently, I used it, and I've gotten quite a bit of feedback from it. So like a lot of complex, events or system setups in our body, I always like the analogy, like I call it the social analogy that people can connect best with. And I've often used our military system in America I believe it's a very powerful analogy to get people to understand how this very important system works. So, and I'll speak for the US military system because that's the one that I understand the best. So the question is, how are Americans protected? If you ask somebody, what protects you from maybe foreign invasion? And so it's our armed forces. And in the United States Armed Forces, we have various divisions. We have the Army, we have the Marines, we have the Navy, we have the Air Force, we have the National or the Coast Guard. And also we have the reserves, the National Guard that we can call upon. And also in the American military system, we've got military bases all over the country where they can, in case of a war or an invasion or something, they can call upon to be able to address the insult. We also have a perimeter protection. I'm talking about Border Patrol. I'm talking about the Coast Guard. And also at the airport customs. That's part of the perimeter protection. We also have an arsenal of nuclear weapons and chemical weapons and whatnot in case we need them. And also, we have a surveillance system, and I'm talking about satellites up in the stratosphere somewhere, and radar, and also spies, human surveillance that can forewarn America in the case of, a foreign entity that's planning something to attack the United States. And also, and all these various factions, all these various pillars have to be kept in good shape, in a state of preparedness. So what do they do in military bases and soldiers and the Marines and the naval bases? They exercise, they have regular physical activity, and they provide them excellent balanced nutrition to keep them in good shape. And also they provide resources for psychological management, stress management. So I'll take you back to the immune system. And if I took a few cc's of your blood and I looked at it under a microscope, I would see something that's akin to the United States Army. And what's that? So I'll see a bunch of different cells of different shapes and sizes and colors, maybe even. And they have names. And some of them are called neutrophils, some are called eosinophils, some of them are called basophils, some are called plasma cells, some of them are called just various names, antibodies. And so they're just like the American military structure, right? And each one of those cells has a specific responsibility. So if you get a bacterial infection, say you get a cut and it gets contaminated by something that's dirty, maybe some fecal material. I don't want to turn anybody off. But what happens is that some of those cells, specific cells, would rush on to that site immediately and overwhelm the bacteria and prevent it from proliferating, growing, dividing, multiplying, or getting into your system. So there's protection right there. And So, and also, just like the military bases, we have places within your body, organs, where many of these cells reside. For example, in your lymph nodes is where some of the lymph cells reside. And so if a bacteria or germ or something happens to get into your system and is traveling through your lymphatic system, which is just a highway, a bunch of highways in your body, just like you have arteries and veins, those are all highways through which the blood courses. Now, if in the lymphatic system, they have these lymph glands that are stationed along that highway, the lymphatic highway, that if a bacteria happens to get in there on its way into the bloodstream, and it gets to that point on the highway, the lymph node, these lymph cells can attack the bacteria, annihilate it, and prevent it from getting any further. So we have those military bases in your system, for example, in your spleen also, that filters your blood. Also in the liver, we have specialized cells that filter your blood of foreign invaders. And also your bone marrow, and I mentioned obviously your lymph nodes. And then in the perimeter protection, just like we talk about border patrol, if you're trying to sneak in through Mexico or Canada or Hawaii or somewhere along the eastern border, Atlantic border, well, you have the skin, and that's part of the perimeter control. And the skin may look innocent, but on that skin is a bunch of bacteria or bunch of elements of the immune system that are stationed there to protect you. And beneath the skin, there are also cells. I don't want to get into the names, but there's some cells called Langerhans cells. And their job is, if something got through the skin, your epidermis, your outer lining of your skin, if it snuck in there, it couldn't get too far because it'll get stopped, it'll get arrested and intercepted by some of these cells. So there's border patrol, there's perimeter control. And also in your mouth, there's a lot of antibodies in your mouth and different factions of the immune system. And this is a portal of entry, just like a port of entry, whether it's New York or New Orleans or Houston or somewhere in Texas. And in your mouth, if you happen to have any germs getting in there or viruses, an alarm goes off, and those antibodies that are stationed there and various other cells of the immune system can attack the invader. We have these as well in the nostrils. We have them as well in the ear canals, and also in your anus, and really every portal of entry, whether it's the vagina or the urethra, which is the channel through which urine flows out of the bladder, into the penis or down into the vagina. So all these inlets have stationed, various cells of the immune system whose job is to prevent an attack, prevent the entry of an enemy.
My goodness, I did not know that the human body is composed of garrisons of military regiments. I didn't know that. Thank you for that explanation. Dr. Zama, are people born with the immune system or they get to develop it?
So we're all born with an immune system, and I will have to start off in something called embryology and what makes us what we are and how we started from the sperm and the egg and we got together. And then the cells begin to divide, and then cells divide into specific cell lines. And so a specific cell line may go on to build your brain and your neurological system. Another one goes on to build the heart and the lungs and whatnot. Another one builds the liver. One of the cell lines goes on to build, your skeletal system. But there's a cell line that goes on to build in the bone marrow to produce the cells, the immune cells, also including red blood cells, which we know about and stuff. And I'm talking about the white blood cells and other cells that are part of the immune system. So yes, now when a child is born or when a child is in utero within the mother's womb, they have a very immature immune system. So they really depend on the mother's protection. But as soon as that child is born and is exposed to all the germs in the environment, that accelerates the process of maturity, maturation of those cells of the immune system.
Dr. Nche Abegly Zama. Dr. Zama, virtually every African is going to relate to the question I'm going to ask you now. Mm-hmm. When we were young and crawling all about the place, our mothers would take us to the farms, and when they tilled the soil, they spread their loincloth or the mat, and we were moving all about, eating all kinds of stuff. Now, in the United States and Europe, when you put a child crawling around the floor, the parents say, oh, no, the floor is dirty. Why didn't the dirty soils we ate back home kill us? Why are we so overtly concerned about the not so dirty floors that we have in the United States and Europe, which would harm the child more?
Well, the circumstances growing up in Africa are different, I do agree. And I believe that, and let me take you back to that analogy of the military system. So if you have all these garrisons, and I didn't want to use the big word, and you forced me to do that. And so if you've got all these garrisons and military barracks around the U.S. military camps or military bases, and these soldiers get up in the morning, what do? They just don't sit around and play cards and drink Coca-Cola and chat about and share stories about their past. No, there's a regimen that they have to follow. They get up, and more often than not, they go into an extreme exercise program in the morning, a vigorous, physical activity program to keep them strong and energized and ready. You got to be ready, because nobody's going to announce way in advance they're going to attack you. So you got to be robust and ready. Well, that challenge I'm talking about happens in your immune system. So your immune system needs to be challenged, because I'll give you an example. So you get a COVID virus, for example. And if a COVID is a brand new virus and your immune system has never seen it, well, they're not going to produce an antibiotic to something they don't know and they haven't seen. But the moment you challenge the immune system with an unknown invader, the immune system has what we call memory cells. Now they look at that and they take a three-dimensional picture of it and they remember what it is. And they may be slow. Your immune system may be slow in responding initially, but the very next time that same invader shows up, that same virus shows up, the immune system is geared up and ready. It knows about the vulnerability of that virus. And so it launches an aggressive response, and with the hope of annihilating it completely. A much stronger response the second time around than it did the first time. So if I take that analogy back and compare a child growing up in Africa, somewhere in a village, and in America where we have a more sterile environment, the child in Africa gets challenged at a younger age and develops a much stronger and robust immune system at a younger age than a child in America under different circumstances. And that's good, because that child is ready. And not only, by the way, for a specific invader, I'm talking about a virus, for example, but because you've got that child's immune system so revved up, another invader that shows up even with a different coat or cloak, that child's immune system is more apt to evaluate and respond much more expeditiously than it would have been for somebody who has not been challenged and has actually grown up in a more sterile environment. And we saw this during COVID, when people were talking about, lockdowns and quarantines. And in some ways, it was good for the elderly and more vulnerable or those with pre-existing conditions. But in a lot of people, it was bad because they need to be challenged. So what happens when you eventually come out of lockdown or shutdown? Well, your vulnerability is even greater.
We love Chat Night Africa.
Even more so when you have this colossus of thoracic heart surgery, cardiothoracic surgery on the show, on Chat Night Africa Healthline. It's hard to not ask people to ask you to throw in questions on heart disease. So please, if you have any questions related to cardiovascular diseases, feel free to ask. Right now, Aneneba Akufo, Attorney Aneneba Akufo says, what an easy breakdown on how the immune system works for average listener. Perfectly done, Dr. Zama. Then he goes further to say, Doctor, do twins have the same genetic code? And how is that related to their immune system? That's Aneneba Akufo.
Okay. So I'll talk about twins in general terms, because if you drill down deeper, then you start seeing vast differences. But yes, as far as the immunological capacity, it should be similar in twins because they get the same exposure in utero. What I mean by when they're within the mother's uterus, they're exposed to the same bloodstream from the mother. And so the same immunological capacity or capabilities that the mother has. So now they may differ after they're born, depending on the variations in their exposure. And if one twin happens to, if they live together, have different types of exposure to different types of environmental conditions that can expose them to different viruses or bacteria, for example, their immune system may be challenged a little different. But by and large, there's similarities.
We move on with other questions from the studio. Professor Nche Abegly Zama, we Africans, especially immigrants, like to put concoctions in the kitchen, like lemon, ginger, and all that stuff. And the hope is to fortify the immune system. Are there things that we can do to consolidate the body military, to make it even less penetrable by the missiles of diseases?
It's an excellent question. And just like those military bases. Now, if the American military, the soldiers, the army, the troops, didn't get well fed, didn't get balanced nutrition, they will not be able to have the capabilities to be able to endure a massive attack by an enemy. And so they're generally well fed, balanced diet, they get very good nutrition to keep them strong, vibrant, and robust. Well, your immune system needs the same. And we know, and I always remember during my PhD program in biochemistry, a professor saying, and during a lecture on the immune system, he says, your immune system is as good as what you eat. And that rings true even till today. Now, why do I say that? We know that we've studied all the cells of the immune system, and we know that what those cells need to be able to function optimally. Now, my PhD dissertation in chemistry was actually on zinc and other trace element metabolism. And I found out during that research that zinc is extremely important for wound healing and also for keeping some of your immune system cells in the best shape. And if you were deficient in zinc, those cells did not function well. So we now know that zinc is very much involved in many of the biochemical events that take place within certain immune cells. And without zinc, you will have significant immune deficiency and your immune system will not be able to help you in the event of an infection and whatnot. Furthermore, things like vitamin C ascorbic acid, or whatever some people choose to call it, vitamin C is extremely important, not just in making red blood cells. I mean, if you are vitamin C deficient, your life expectancy will be, for a long period of time, would be foreshortened. And let me just backtrack a little bit. And for some of you who've probably watched a couple of my talks on this topic, the most common cause of death among ancient mariners was a condition called scurvy. So if you look at Magellan and you look at some of these pioneer sailors that were looping around the planet, and oftentimes when they left, only about 20–30% of the sailors would return. And most of them died from scurvy. And it was not until the late 1700s that it was discovered that this was due to a deficiency. And actually, it was the first vitamin deficiency to be associated with a clinical condition. And what happened is that later on, we found out that vitamin C was extremely important in the healing process, which is really about the immune system, functioning of the immune system. So yes, in answer to your question, if you practice a balanced nutritional lifestyle, you're more apt to keep your immune system in a robust shape, and it would be much more prepared to protect you. But if you have deficiencies, nutritional deficiencies, then you put yourself at risk. Now, a lot of us choose to use things like the ginger and this, that, and the other that maybe doesn't have any scientific evidence to support it, but if it feels good to you, it's fine. But so long as you subscribe to the established scientific program that supports certain nutritional agents or supplements or micronutrients which can be helpful to help your immune system, you'll be in better shape.
We love Chant Night Africa.
Professor Nche Abegly Zama, world-class cardiothoracic surgeon, lecturer at Harvard, and you've cut through so many, many, many hearts. How many heart surgeries have you done? Can you count them?
I have done thousands of open heart operations in babies and adults, and I can't tell you how many. And not only that, to be an American trained heart surgeon, you have to complete training in general surgery. And so even though I transitioned from heart surgery and went back to school to study cardiothoracic surgery, I still perform a lot of general surgeries on my missionary trips around the world.
Dr. Zama told me, is there any correlation between the immune health, robust immune health, and sleep, proper sleep?
Yeah, absolutely. And that's an excellent question. And our people need to pay attention to that. Now, the average, I can't speak for the rest of the world, but I know the statistics in America. The average American doesn't get enough sleep. And I'm talking, you need at least 7 hours of sleep a night, 7, 8, maybe even 9 hours. But, that may not be compatible with, everyday life and workforce issues and stuff, lifestyle. But you need at least 7 hours of sleep a night. And the reason for this is because this complex system that we call the immune system is working hard for you around the clock. And it also needs a break. Now, it's not going to stop completely, but if you're in an aroused state, well, your immune system stays aroused. And why is that? Because it's a complex system that is integrated with your neuroendocrine system. And so your neurological system is wide awake when you're awake, and your neurological system is connected to your endocrine system. And there's certain hormones, that oftentimes, depending on what time of the day it is, and I don't want to use it's called a diurnal rhythm. Certain times of the day, you may have lower levels of those hormones, and specifically at night when you should be resting. And so if you don't rest and you keep your body revved, you can actually overwork your immune system and put yourself in jeopardy if you encounter a situation, maybe an attack from an invading parasite, bacteria or virus, and your system will not be prepared to help you. So yes, you need to get enough sleep because that helps keep your immune system strong. And you can say the same for the military. If you kept your soldiers up all night partying and stuff, you know, in the event of a surprise attack, they're not going to be able to handle it. You know, they're not going to have the energy and the stamina to do it.
I just
and
had a
that
question
applies to the
texted
immune
me.
system.
I just had a question texted me, Professor Zama. Let me scroll down. Yeah, Professor Zama, is there any relationship between a breakdown of the immune system and stress /
Yes.
anger?
Yes. Yeah.
How so?
Stress suppresses immune function. And I'm going to give you an example that practically all of us out there have experienced. Have you ever been under so much stress, whether it's environmental stress, lifestyle, whatever it is, extreme stress, and you just feel sick, and maybe you even catch a cold, you know, and which would be very unusual for a lot of people, and that's related, and the studies have shown that is related to a suppression of your immune system by stress, and then increases your vulnerability to maybe a virus infection or so. And so yes, extreme stress can have a negative impact on the immune system. Now, I'm not saying a stress-free life is good, because that's not possible. You need a certain level of stress. But stress becomes a pathology, meaning a problem, when it exceeds your body's capacity to grapple with it.
We love Chat Night Africa. Keep watching Chat Night Africa.
And Healthline on Chat Night Africa is reaching you live from Washington, D.C. metropolitan area. My name is Divine Nche. Dr. Zama, we hear a lot that laughter is the best medicine. Could this be related to the health of your immune system, sir?
Yes, absolutely. So the body is just an amazing, amazing thing. I mean, it's just, and everything is so integrated. Nothing functions in isolation. So stress, as I mentioned earlier, actually affects every organ system, every part of your physiology. Physiology is how your body works in the details of it. Now, so stress affects it. And if stress affects it, well, in contradistinction to stress, you know, being in a good mood, you know, having a sense of elation, happiness, and joy, that also has a positive impact on the immune system. And there's been studies that maybe show some correlation between survival, how long you live, depending on what type of personality attributes you have, the lifestyle that you've maintained. If you have a happy lifestyle full of love and joy and positivity, a lot of those people may live longer. And also they have fewer infections and illnesses and stuff. And that's also been correlated to some degree with a better, proper functioning immune system. Now, there's certain chemicals in your body called endorphins and enkephalins and prostaglandins, and people they found out who are experiencing a joyful, delightful experience in life, or maybe just have a positive attitude about things, have higher levels of some of these chemicals, endorphins, which also chemically have been shown to have a positive effect on helping the body develop mature and robust and strong and aggressive cells in the immune system.
Granting that somebody is born with a steel-plated immune system, what are some lifestyle habits that could lead to a degradation of this military that we have in our bodies called the immune system?
So to answer that, I'm going to take us to kind of backwards to maybe a child that's born with a deficient immune system. There's actually a condition called immune deficiency disease, and some of you may have heard about it. And many of these children are highly vulnerable, and a lot of them succumb at a very early age to minor infections that a normal, healthy person or child would ordinarily overcome. And so this tells us that the immune system really is very powerful and plays an important role in our lives. Now, some of the things that you can do to diminish the functioning of your immune system, things like obesity. I mean, it's been shown when you gain too much weight, it actually has a negative impact on your immune system. Things like diabetes, diseases like diabetes. Diabetes suppresses the immune system. We know that diabetics have a rough time healing wounds in their body. As a cardiac surgeon, probably the most complications I would see when I cut somebody's chest open or saw somebody's chest open and have to wire it back shut. The highest number of infections involving those are in diabetics, for example, or even just a wound in the extremity somewhere doesn't heal as well because the condition of the diabetes suppresses the immune system, immune function, and puts it at a disadvantage. Cigarette smoking, for example, is bad for the immune system. So people who have COPD have challenges. And if you see during COVID crisis, the highest mortality was in the inner cities. And if you live in the inner cities, you effectively have COPD, chronic obstructive pulmonary disease. So you have lung problems. You may say, gee, I feel fine, I breathe okay, I'm not taking any medication. But because of so many pollutants in the atmosphere, your lungs are generally not in the best shape. And those cells in your lung, immune cells that are meant to protect you, are overwhelmed day in and day out, addressing all these pollutants, and then a virus arrives. And those cells are not in the shape to be able to handle it and protect you. So yes, there are things. And obviously we've talked about nutritional deficiencies that can put you at risk.
Here is a question from Lambert Mbaum. Doctor, many of us have high cholesterol levels and don't seem to make a correlation with heart diseases. What lifestyle changes should one make, especially when one has stopped taking medications?
So I'm the kind of doctor who if a patient shows up with high cholesterol, first thing I do is not medication. I mean, I got a call from a mother a few months ago, and her 14-year-old had a cholesterol about 500, something really ridiculous. And he was overweight, and he was basically sedentary. He didn't play, comes home from school, and so we put him on a regimen. And also his nutritional intake was really not good. It was high in fat and high in cholesterol. Unfortunately, the kind of stuff kids like to eat these days, cheeses and pizzas and shakes and hamburgers, this, that, and the other. So we put the kid on a regimen. And thank God he was very compliant. And a few months later, the boy showed up with a cholesterol of about 150. I mean, that's dramatic. And he'd lost, I'd say, about 30 pounds or so. And so one of the things that you can do, cholesterol is bad. It's not bad, but it's bad in terms of it puts you at risk for heart disease. And I would say if you have high cholesterol, the first thing you need to do is, what am I doing wrong? And if the things that I'm eating that increase my cholesterol level, I need to change. I need to restrict them. And if I'm not as physically active, well, I need to start on an exercise regimen under a doctor's guidance, because it's not good to start from 0 to 100, because you may have certain pre-existing issues that you're not aware of. And so, yeah, if those don't work, those interventions of exercise, nutrition, lifestyle changes, and that's when I would consider putting somebody on medication. Now, remember, we're all a product of our genes and environment. A lot of cholesterol problems that we see are environmental, which means they have to deal with our lifestyles. But also, there are individuals who are born with genetic deficiencies that cause them to have higher levels of cholesterol. Just as an aside, I was just in South Africa a couple of months ago in Pretoria, and on the flight, I ran into a gentleman, and I got to talking to him, and I noticed something around his eyes, and I says, when you get back, you need to get your cholesterol checked. And he goes, what do you mean? I said, well, I'm a cardiac surgeon. I've seen this before. And it's just, so I got a call later, and it turned out he has a high cholesterol, and we wound up having to have a coronary stent because in the process of evaluating him, they found him to have a blockage. So for him, and this was a thin gentleman that was fit, and thank God he didn't suffer a heart attack, but he got it addressed. So some people have a genetic predisposition to high levels of cholesterol.
You were watching this monument of heart surgery, Professor Nche Abegly Zama. And the broadcast is Healthline on Chat Night Africa. My name is Divine Nche. You can see the quality of people we bring to this platform. They have live transformative information. But again, having the information is one thing. You have to be ready to act on it. That's when it makes a whole lot of difference in your life. What could prevent the immune system from working properly?
So, as I've mentioned, there's just a lot of stuff. Now, if the immune system is challenged by a massive infection, and an individual with multiple risk factors, it can actually crash, just like a computer crashes, you know what I mean? Or just like, if there's an overwhelming attack to the country, things can kind of fall apart, decompensate for a while. And I'm talking about a massive attack from, use COVID, for example. If you get COVID and you have some of these pre-existing factors, the lung problems, you have nutritional problems, you have cardiac problems. I didn't even mention cardiac as a risk factor, but that's also a major risk factor. And you see so many of the mortalities associated with COVID who had pre-existing problems. One of those problems we found oftentimes, as I was taking care of patients, was cardiac problems. And so the things that can cause your immune system to fail, generally things that are pre-existing, right? Lifestyle-related issues, like nutritional deficiencies, pre-existing healthcare problems, and also the type of infection that you're confronted with and you have to grapple with. And sometimes if it's an overwhelming bacteria or a viral infection, your body can decompensate.
Doctor, you started this program by elaborating so succinctly where all these military bases are in the body. So if they're so good, if they're soldiers, heroes for our bodies, why then do we get sick? Don't they just fail, or you have some illnesses that sneak past the radar system of the immune system? What happens?
Well, so I don't want to sit here and give you the impression that medicine is all-knowing. There's still a lot of vacuums, a lot of gaps in our knowledge about the human body. It's just a magnificent, and just in the decades that I've been practicing medicine, both as a clinician and a scientist, medical knowledge has evolved just stratospherically. And so there's still a lot of gaps. And now, why do you have a 41-year-old healthy athlete who dies from COVID, for example, and who has no cardiac problems, no respiratory problems, no problems with their blood system, and all of a sudden they get COVID and they die? So the future of medicine, I've said this time and again, the future of disease, human disease, will be elucidated once we get a good grasp on immunobiology, because that's where it's going to be. And a lot of things that happen to us, our proclivity or our vulnerabilities to certain conditions, that has to do with our genetics. And I think, when the Genome Project in early 2000 was great and has brought us a lot of knowledge, but I think we still have ways to go And decades from now, we will understand why. Or
Here's
why.
a question. Yeah, here's a
And
question from Mr.
Sure.
Gemda Buinda. If you have a weak and enlarged heart, can this situation be reversed?
Well, it depends on what the cause is. So if you, an enlarged heart is something we call cardio, which has to do with heart, megaly, which is big, and or it can be cardiomyopathy. Myo is muscle, pathy is sick, cardiomyopathy. So that's a enlarged heart, which is a sick heart. And so you have to look at the cause of it. It can be due to high blood pressure. So if you address the high blood pressure, you may be able to reverse the process or improve the function of the heart. Now, hopefully the heart has not got to the point of no return, because that can happen. You stretch that heart muscle, you punish it for such a long time, it's just not going to come back, even if you correct the inciting agent or the cause. Now, you can also get an enlarged heart from a structural problem, maybe a valve in your heart that is not doing its job. It's gotten calcified like concrete. It's not moving and opening and shutting as smoothly and silky like it used to. And that can lead to it. Now, if you replace that valve and address the problem, generally those patients, the problem will improve. You can also get it from a problem, maybe a parasite. And we've seen that a lot in South America, especially where I used to go and operate, that attacks the heart directly and attacks the heart muscle. And those patients develop heart failure. And that's a real challenging situation, because those hearts don't generally come back, and you may have to do a heart transplant to address it and save the patient's life. Now, there's an operation which is heart reconstruction, which I and a few others in America have done and continue to do. It has a very long word that I'm not going to bore you with, but I just call it, it's like plastic surgery of the heart, where you have a patient, and generally they're patients with a history of chronic coronary artery disease, where the heart has been starving for so long because of blockages in your coronary artery and not enough blood getting down to the heart muscle. Now remember, your heart beats about 120,000 times a day and doesn't stop to take a break, and so it needs reliable nutrition, reliable supply of oxygen. So if you have blockages in the pipes that feed the heart, and then the supply of blood goes down, but the heart is still being asked to continue to do its job by every part of your body. And over time, that heart gets weak and tired. Now, that's a cardiomyopathy. Those hearts can become very enlarged, and they may even develop scars and get weak. Now, there's an operation where we can go in there, get in the chest, take out the heart, and cut out parts of it, throw it away, and reshape the geometry of the heart. And I've had patients. I remember it was 2003 or so. I'd operated on my first patient with this. He came to the hospital on a gurney, actually, and his heart function was about 10-15%. And after the operation, I sent a copy of the post-operative echocardiogram to the cardiologist, and he called me and yelled at me for having sent somebody else's echo to him, and I reassured him it wasn't the case. So this guy went from a heart that was practically dead to a normally functioning heart. So there are options for it. And of course, there's also medication that can help some patients to be able to improve the functioning of the heart if the heart is enlarged.
Now the phone line is open. Hear me again, the phone line is open. I have to tell you, if you have to pay to consult this guy, it's expensive. It's very expensive. If you have to pay, we are bringing him to you on Chat Night Africa platform, and you can dial and ask him your questions unfiltered. The number is 240-603-7367. 240-603-7367. If you're overseas, you simply do 001, and that way you can get through to us via What's up?
We love Child Night Africa.
Doctor, when I look at you, I really marvel. I mean, at the wonders you do to save lives across the world. What would you say was the most complicated heart surgery you ever had to work upon? And how far did you succeed?
Actually, I'm a high-risk cardiac surgeon, so I'm just used to being a bottom feeder. So I take the stuff nobody wants to deal with. And so I'm used to just really doing complicated surgeries. But I believe the ones that stick out in my mind, the one is actually a baby who was born with the heart hanging out of the chest. And that was tough because, actually in embryonic life, your heart is actually not in the chest. These organs are out here. And then eventually they wind their way into the chest and things get well rearranged. So the left lung is over here and the right lung is here and the heart is in the middle and stuff. But sometimes the heart gets forgotten outside of the chest. And so you see a baby that's born and the heart is there like an almond. It's just beating away. And so that was a complex operation. It took us, and we had to fix some of the congenital problems with the heart. We had to get the heart back into the chest. And there's several steps to this process, and then slowly close the chest over a period of time to accommodate this new guy, and make room for the heart in the chest. So that was difficult. And it's not just the technical challenge of it, but also the emotionality that's involved. And I'm not even talking about the caregivers like myself and the great doctors and nurses that I work with. I'm really talking about the families, the parents, the father, the mother, the siblings. And you're really operating on an entire clan. And that just sucks the life out of you sometimes. I was drained. These children, a lot of them don't survive. But this particular child, this was in Boston, and the kid survived. So that has always remained memorable and special to me.
We are talking about these regiments of the military germ fighting heroes in our bodies called the immune system. And the monument of medicine we have on the platform is Professor Nche Abegly Zama. Doctor, are there times, would you advise people or someone to go to the doctor and say, hey, how does my immune system look like? Would you check that? I would like to know what mine is.
Well,
maybe you
actually,
too.
I think it's probably just good to get regular medical checkups. And in the process of doing that, if you have, if you're having symptoms, by and large, you need to see a healthcare provider. But if you're not, and you need to have like regular medical checkups for several reasons, because a lot of things, conditions begin to develop and they're not as apparent. But oftentimes it's good to nip things in the bud. So if a condition is diagnosed sooner, there's a greater chance of cure. And I'm talking cancers and stuff. And cancers and immune systems are inseparable. But as far as finding out if something is wrong with your immune system, just the best way to start is a regular blood evaluation and a blood count and the different cells in your blood, the numbers in there and stuff can tell you quite a bit about how your immune system is functioning.
And are we talking here about the white blood cells or the red blood cells? What should we be looking at when that report comes out? I know the doctor's going to tell us too.
I was just going to say it's probably best to allow your doctor to interpret it, because this is something that is extremely complex, because sometimes a number may be elevated. Now, if I wasn't a doctor, I generally run very low white cell counts. And I found out that many of the folks who have similar background as I do run low white blood cell counts, the total, that is. And And really it's geographic. When I was in Asia and I would look at, when I traveled to Asia to operate, or even South America, I would notice that they have their own normal ranges. So if you try to interpret it by yourself, you may create unnecessary anxiety within yourself. So I'd like to relegate that to the doctor. Yeah.
You are watching Healthline on Chat Night Africa.
We love Chat Night Africa. Keep watching Chat Night Africa.
And my guest is Professor Nche Abegly Zama. Is it likely that people in their mid-20s or early 30s would have a more robust immune system and not people in their 70s? And if the answer is yes, what does somebody in their 70s or advanced age do?
Yes. As you get older, your immune system becomes weaker. And you're more vulnerable to infections and whatnot, or any of the things that the immune system does to protect you against viruses, bacteria, parasites, against cancer, and also wound healing. So as you get older, your wounds don't heal as fast, and the incidence of cancer is higher it becomes greater as you get older, and we know that. And also, if an elderly person gets a pneumonia, they have a very high mortality. There's a greater chance of dying than a younger person. And so now what can you do? Well, there's some things we can do. There's a lot of exciting ongoing research in geroscience, an area that has to do of science that has to do with aging and the elderly. And some recent research is actually showing that there are certain agents, natural products that can help improve your immune system and overall improve your capacity to withstand an infection in the case of one, whether it's a viral, parasitic, or bacteria. And also it helps to improve the functioning of your organs. So you got to look at the body as a set of a system with organs, or look at the body as something with systems, and within those systems, organs. So if you say your respiratory system, that includes your trachea and your lungs and whatnot. As you get older, they don't function as well. Your cardiovascular system, the heart and the blood vessels. Now, new research is showing us that there are ways and things that we can do now to kind of reboot many of those systems and get them working as well as they did many years prior. Now, I'm actually coming out with a line of supplements, and I've been working for a long time, on this, and that are based on a lot of the contemporary research that can actually help people as we age to be more robust, help change many of or at least eliminate or reduce many of the physical changes that we see with aging, in addition to revving your organs and making them stronger and more robust to be able to do for you what they need to be doing: your heart, your lungs, your liver, and even your neurological system, even reduce dementia. There's a lot of research that has shown that. And so there are things that we know now, and many more things in the horizon that can help you as you age, including your immune system. Now, the immune system is always in the middle of that. You can't really separate it from the functioning of the neurological system or from the functioning of the cardiovascular system, because they're all implicit. Because remember, the immune system has to do with not just protection, but healing as well. And so if people get more vulnerable to cancers as they get older, if there's something you can do to beef up the immune system, well, remember, all of us on a daily basis, we're producing cancer cells. As I'm sitting here, I'm making cancer cells. But the body's immune system is working hard to eliminate them, grab those cells, annihilate them. I mean, they have like immune system cells that are like a chemical attack. You know, they see a cell that they don't recognize, which is what a cancer cell is. It's not a normal cell. And what they do is they grab it, they attack it, and they use chemical warfare, and I mean real chemicals, to get rid of it. So if you have a robust immune system that around the clock, you know, it's making its rounds around your body, you're in good shape. But as you get older, if that system is not doing its job, and then you're more apt to have bad actors, like a cancer cell somewhere, lurking somewhere that begins to grow, multiply, and divide and get real big into a tumor, and you're not aware of it until it's too late.
Wow. I told you that when Professor Zama comes, he brings on a lot of massive firepower. You're beginning to realize that. Honestly, I didn't know that every minute our bodies are producing cancerous cells, and thanks to the immune system, we really don't develop the cancers a lot of the times.
Yeah. Well, just think about it. I've talked about the surveillance system. The American military is successful because they have a great surveillance system. They have spies all over the world. That's part of it. They've got radar, they've got satellites. Well, your body does that too. And there's specific cells, which are called surveillance cells, you know, interesting, and memory cells. And they have signals, communication, ongoing between them. Just think about it. You know, if I get a scratch here, a cut here, and all of a sudden, you know, a few days later, there's pus coming out. That pus is really fallout from an attack from your cells of your immune system and the bacteria. The bacteria got killed and destroyed. There's been a lot of devastation. And then it's time to clean things up. And the immune system sends specific soldiers to come to the spot and clean it up. And then the body starts to heal and the wound heals. So what happens in your body as well is that your body, every bacteria or virus you've ever encountered, the body knows, because there's certain cells called memory cells, which are part of this surveillance system. They recognize this invader. The next time you show up, a phone call goes to the appropriate army bases in your body. It says, he's here. And what do? You know, they deploy the troops instantly, and the response is instant. And they come with the weapons they know you're most vulnerable to. Because the first time around, the response was not as robust because they didn't know you. They've got a three-dimensional map on you. And so that's how the body protects, the immune system protects you.
Mr. Gemda Bwinda writes again, how frequent should people do a regular medical checkup?
Well, for a healthy adult male and female without a family history, so it really has to be individualized. Let's take, for example, I mean, if you're a 40-year-old man with no family history of nothing, and you don't have diabetes, you don't have high blood pressure, you're not overweight, and a yearly checkup is good enough. I mean, even biannual, but you got to know your history. I mean, if you don't have any pre-existing problems, but you have a family history of prostate cancer, for example, well, you need to get annual checkup. That's recommended. The history of colon cancer, for example, you need to get checkup. If you're a woman, you know, with a history of breast cancer and some of those other things that run in families, diabetes, you need to. But otherwise, I think an annual checkup is good for all of us who have access to healthcare providers where we live.
That is Professor Nche Abegly Zama today on Halfline on Chat Night Africa. Dr. Zama, what happens when you see inflammation of the lymph nodes or other inflammations on any part of the body anyway? What is happening? What is that cause for worry?
Oftentimes, no, because it's just the body doing its job. And so inflammation is good and bad. Inflammation really, well, there are four, or maybe modern medicine has a fifth, things that you see with inflammation. Okay, there's the redness, there's the swelling, you know, there's the pain, and you know, so maybe loss of function that's associated with it. I don't want to drag you into a medical school lecture here, but inflammation means the body is doing its job, you see. Now, things get bad if inflammation becomes chronic. So if you feel, for example, a painful lymph node somewhere in your body, and generally after 2 weeks, within 2 weeks, it should go away. If it lasts longer than that, then you need to get it evaluated, because that could be something bad, for example. And also, you need to know your risk factors. If you're a smoker, well, you need to rule out the possibility of cancer, because I've actually seen patients, show up and say, well, I've had this lymph node, and it's been for a while. And now, fortunately, for malignancies, you don't get pain associated with a lymph node. It's inflamed in terms of a lot of activity that's ongoing there, but it's not infectious. But anything that persists for over a couple of weeks, I believe it needs to be evaluated. Now, remember, there's something about the immune system you mentioned. This word inflammation, you're going to hear a lot more about it. We now know that about a third of all cancers or inflammation is involved, or the cause in about a third of all cancers, or neurocognitive problems like the dementias and stuff, inflammation is involved. And also in other chronic problems like cardiovascular disease. About a third of the patients with those blockages in the coronary arteries that lead to heart attacks, the number one cause of death in America, coronary artery disease, and really in many places in the world, a third of those people, the cause of it, and a third of them is inflammation. Also diabetes, also a lot of the autoimmune problems, autoimmune, and give me a second to define that. What are autoimmune problems? Diabetes, lupus, thyroid problems, chronic arthritis, rheumatoid arthritis, and I can go on. And those are autoimmune problems. And what happens is that your immune system that is set to protect you sometimes fails to recognize you as self. Now, the immune system is just brilliant. I mean, it can tell all those cells, immune cells, as they're coursing around your body. When they encounter a cell, they can say, oh yeah, that's a red blood cell. He's one of us, or she's one of us, and they go to your organs, your brain and your liver. They get down to your joints and they're coursing around. They go, no, he's one of us. Let's leave it alone. And sometimes those signals get, mixed up, and then they fail to recognize you as parts of your body as self. And what do? They do what immune cells do. They launch an attack. And you wind up with rheumatoid arthritis. You wind up with diabetes. You wind up with thyroid problems. And you wind up with a multitude of other things, the lupus and this, that, and the other. And so, yes, your immune system itself can actually become your enemy.
Wow, this is amazing. You are watching Healthline on Chat Night Africa, and my guest is Professor Nche Abegly Zama.
We love Chat Night Africa.
He will be right back. Time for us to have a musical interlude. We reserve the best for last. There are lots of questions I'm getting about the thyroid, why it's so dangerous to operate on. As we know of cases of in the cases in Bamenda, people went there for surgery, took the taxi, drove, and didn't come back. Whether it's worth doing a thyroid surgery, we will come to all of that, and then some questions related to heart surgery. Time for us to have a 2-minute break and bring back Professor Zama. I'd like to also inform you that this broadcast is currently on the internet, also in high definition. You simply go to www.chatnightafrica.net. You can also watch it on YouTube in high definition. It's on Facebook. We are on 5 different platforms running this broadcast concurrently. And whenever you come to watch Chat Night Africa, this is the kind of content you get. We bring you live transformative content. My name is Divine Chamakong. Watch this beautiful, beautiful video, and I'll be right back in 2 minutes with Dr. Zama. Watch.
SG Record.
You go be na nyang nyang, you go be na nyang nyang. When God touch your life, you go be na nyang nyang, you go be na nyang nyang. Children of God, how we do? We be nyang nyang. People of God, how we do? I say we be nyang nyang. Ube Yannick, how you do? Oh my friend, I be nyang. Mama Bang say Julie, how you do? Oh I be nyang nyang. Me as you go, how I do? Oh I be nyang nyang. People of God, how you do? We be nyang nyang. Mes amis, écoute, Oka. God, I want to be a model in my generation. I want to be a model in my generation. Papa got to disconnect me from all wrong connection. Papa got to disconnect me from all wrong connection. Because I was born to lead, not to follow. You were born to lead, not to follow. The level where we there, no be our level. If you believe me, brother, join me, we sing. When God touch your life, oh, you will become young, young. Even mama, even brother, oh, you will become a model. If you believe in God, join me, may we sing. Say I want to be a model in my generation. I want to be a model in my generation. Papa got to disconnect me from all wrong connection. Papa got to disconnect me from all wrong connection. Higher, 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 higher. Disconnect me. Hallelujah. Amen. People of God, now how we do? We be young, young. Children of God, how we do? I say we be young, young. Me so easy go now how I do? Me so I be young, my young. Manager, now how you do? Hey, be young, young.
The Bible says, touch not my anointed and do my prophet no harm. Philippians 4:13 says, I can do all things through him who strengthens me. If Jesus is for me, who can be against me? Who can?
No person, no fit triumph. We be young, young. No person, no fit triumph. Oh, we be young, young. No dirty my life. Oh, I say I be young, young. No destroy my name. Oh, I say I be young, young. Wajam jam jawai sema, wajam jam jawai sema, be wajam jam jawai sema, wajam jam jawai sema, wajam jam jawai sema, wajam jam jawai sema, be wajam jam jawai sema. In your business places, I pray favor follow you. In your marriages, I pray favor follow you. In your families, I pray favor follow you. Anywhere you go, I pray favor follow you.
You got on me?
All right, that's Nyang Nyang by by Eziko. Please go on YouTube, search Eziko Nyang Nyang, and support him. We appreciate him allowing us to use his video, his music. We got prior authorization before we blasted this song Nyang Nyang on Healthline. I'm going to be bringing up the medical doctor, Dr. Nche Abegly Zama, momentarily. Here is what Dr. Divine Nche says. Greetings, big brother. Technology improved surgical outcomes, didn't it? Thank you, Dr. Nche Abegly Zama. Now we're going to launch into a lot of cardiovascular issues before we wrap up in a few minutes. But again, you can dial the number 240-603-7367, 240-603-7367. If you're overseas, do 001 to get through to us on the platform via WhatsApp. Ladies and gentlemen, once more, join me in welcoming Professor Nche Abegly Zama.
We love Chat Night Africa. Keep watching Chat Night Africa.
And when you come to Chat Night Africa, this is the quality of broadcast you get. I want to thank you again, Dr. Zama, for accepting. You're a very, very busy guy. Sometimes to get to is a problem. Now, let's talk about thyroid surgery. Recently, I know of 2 cases. People went looking great. People were asking whether it was not even for aesthetics, just to look great, look beautiful, without the thyroid thing in the neck. So, is it advisable to do thyroid surgery? And at what point would you advise somebody to do it?
Well, so I talked about chronic inflammation and autoimmune diseases, and I mentioned that 30% of the cases we see of cancer and autoimmune diseases, for example, and neurocognitive problems, metabolic diseases like diabetes, are related to chronic inflammation. Now, the thyroid also, there are certain problems. There's a condition with the thyroid actually called Hashimoto's thyroiditis. And I don't like to use the big medical words, but that those conditions are related to the thyroid. So let's get back to what's the indication for thyroid surgery? What are the indications? One, for thyroid cancer. Now, you can treat thyroid cancer depending on what cancer it is. Because if you say thyroid cancer, you have to be specific. Because cancer is like saying there's a car outside. So I know it's something with 4 wheels. Now, the question is, what kind of car is it? Is it a Toyota, a Mercedes, a Lexus? Is it a Ford? Is it a BMW? Whatever. And so, because it makes a difference. And then, if you say there's a car, well, is it an SUV or is it an automobile, like a luxury automobile or something specifically? So when it comes to the thyroid, when I say malignancy of the thyroid, it depends on what malignancy we're dealing with. And certain malignancies of the thyroid may generally only affect the site where the tumor is. I mean, you probably don't have to take the entire thyroid out. You just remove either the left lobe or the right lobe. The thyroid has 2 lobes, actually. Actually, let me just really brief in a few seconds give you a thyroid anatomy. The thyroid is a gland that is somewhere in the middle of your neck there. And in some people, it's more visible than others. And it's an endocrine gland. And so it produces a hormone called thyroid hormone. And that gland is under the influence of another gland in your brain that's called the pituitary gland, which is the master gland. So the thyroid gland is very important. It serves a role in your metabolism. So and if your thyroid is not functioning well, what happens is you may gain weight, you may get sluggish, your neurological responses may not be what it is, your heart may not function properly, you may be more constipated, your menstrual periods may be very light, you may even skip periods. If it's functioning way too much, you can have menorrhagia, you're bleeding excessively for sometimes a week or so. Your heart is beating really fast, and you're sweating a lot, even when it's very cold. Just a lot of stuff like that. And so you can see how important the thyroid is. It affects your entire body, how it works. It helps to maintain your body temperature and how things work in your body. So if that thyroid is, if you need surgery, there has to be an indication why. So if you have a cancer, well, it should be removed, or you can receive radiation therapy for it, and that's another option. And for certain types of cancers, depending on where you are, they can treat them with hormones if you don't have access to any of the modern resources. Now, if it is just an enlargement of the thyroid that begins to compress your airway and causes problems with breathing, then the thyroid should be removed because it can affect you adversely. Now, I've had to do that. Many of those thyroids get so big, it's huge. I mean, they're not in the neck, they're in the chest. And I have to go through the neck, but deep into the chest to pull them out and then remove them. And then sometimes you get just an inflammation of the thyroid from an infection, and that can happen. And those you don't need to have surgery. So it depends on the indication. So my assumption is that somebody presents somewhere in Africa or wherever with a thyroid problem and needs to have the thyroid removed. So to be objective, the conditions depend on the individual and their presentation. But the thing I know about thyroid is having done a lot of thyroid surgeries, and I also do thyroid surgery because that's part of the airway as a cardiothoracic surgeon. That's within my realm. It is a complex operation. Why is that? So the thyroid itself has another endocrine gland called parathyroid that lives inside the thyroid. And actually, when they're developed in embryonic life, they come together and then they stay together for the rest of your life. And most people have 4 of those glands, the parathyroids, inside the thyroid. So if you take out the thyroid, you got to protect, at least save one of them. And what I always do is cut a muscle like this muscle here in your neck, we call the sternocleidomyostoid, and then implant some pieces of a parathyroid there. It'll grow and develop new blood supply and do its job, because the parathyroid is important in calcium metabolism, and you need it. So the patient doesn't have to be taking calcium supplements. Now, also there are nerves around the thyroid. There's 2 vagus nerves on either side of it, very important nerves. Now, the vagus nerve is the thing that drives your digestive system and make things move all the way down to the exit, somewhere down below. And so that's the vagus nerve, and helps you to produce digestive juices and communicates with the brain, the stomach. So those nerves are right next to you. And also, there's other nerves that have to do with your voice. Now, if you ever had somebody have thyroid surgery and they get out and, and then they can't maintain their voice at a certain caliber and level, and it keeps going up or down. And sometimes they talk with a shrill, or sometimes they talk with a normal, pitch. And if they've had thyroid surgery, chances are that nerve got damaged. And so, and not only that, there's a couple of big blood vessels, the jugular veins, and maybe even the carotid artery that are not too far from there. And right in the midline, where the thyroid is lying, right on top, is the trachea. So you can see there's so many landmines in the area that if somebody is not as conversant with that anatomy and has the experience in avoiding, it's not to address, it's to avoid, it's to observe it and preserve it during the operation, you can imagine there may be disasters associated with it.
Quite clearly explained, sir. I have a question, and the person prefers to remain anonymous, and that's okay. Doctor, can heart problems be caused by blood pressure? And if yes, can it be reversed with constant medication?
So one of the major risk factors for cardiovascular disease, the most common cause of death is coronary artery disease, blockages in the tiny vessels, really tiny, that supply blood to the heart muscle I mentioned earlier. Now, high blood pressure is a major risk factor for those blockages that happen in the coronary arteries. Now, also, high blood pressure is important in the functioning of the muscle of the heart itself. Remember, the heart has to squeeze blood. It receives blood from the lungs, and it has to squeeze oxygen-rich blood out through a pipe called the aorta to nourish the body. If your blood pressure is high, then the heart is squeezing against much greater impedance, resistance. And just think, if I had you doing flexion extension exercises with a dumbbell, and you started off with 2 pounds, oh, that's easy. If I double it to about 4 pounds, you start feeling some stress, but you can keep going. If all of a sudden you're now at 20 pounds, what's going to happen? Your biceps, you're going to start feeling a lot of pain, and you're going to be very uncomfortable. And chances are, eventually, you'll just give in. So if you have high blood pressure, that needs to be addressed. If you address it, the heart will function better. Now remember, if you have chronic high blood pressure, actually we call it hypertension, if you have chronic hypertension, you may get to a point where you've developed that sick heart we call cardiomyopathy, and it's a point of no return. So even fixing the blood pressure may not help it. Now, also, if you have high blood pressure for a long time, and and you put that patient on medication, the body has become so used to functioning under in a tense environment, high blood pressure, that if you drop it even to a normal level with medication, they can actually decompensate. They can do really bad. And you may go into heart failure, for example, which is ironic. So I say, when you get a diagnosis, that's why it's good to get your checkups. If you get a diagnosis of blood pressure, first thing you do is, what am I doing wrong? Am I eating way too much salt? Actually, if you do that, you could save about 2 million lives in Africa. Reduce the salt intake. Or is my cholesterol high? Am I not exercising enough? Am I overweight? Am I smoking cigarettes? Do I have diabetes and I'm not managing? And all these things, I think if you address that, then you have a better chance that your heart will continue to function. And even if you have to take medication for your blood pressure. I don't believe in medication initially. I believe in doing things that would naturally put you back in a stable, a more normal state.
Now I understand why it is commonly said that blood pressure is a silent killer.
We love Chant Night Africa.
I have 2 questions before I let the doctor go. I don't know, maybe we'll have to organize a session uniquely for blood pressure because it's killing so many people. So I really, really pray that you will have time to come for that broadcast.
Oh, sure, I'd love to.
Thank you, sir. Thank you for making that promise.
Yeah.
It will be exclusively for high blood pressure. So stay tuned. That will be coming very soon. Doctor, I have 2 questions before you go.
Sure.
We've had situations where people go to bed in the evening feeling fine, no problem, and in the morning they don't get up. You see the body lying in bed and they didn't kick around, they didn't kick the sheets off their bodies. So why would what happens that somebody dies that way? And it could happen to anybody.
Yeah. Well, in some cases you can predict if somebody has known risk factors for sudden death that are not addressed, well, then it's like a time bomb. And one of these days it's going to happen, and it may not even be at night. They could be out exercising, having dinner, just having a good time with their loved ones, and they collapse and it's over. So the most common event preceding an individual's demise is cardiac arrest. I mean, there are many other things that can happen. And so somebody can die suddenly at night because either the heart goes into a bad rhythm. And we see this actually on the football sports fields, where an athlete and young folks collapses, and if they're lucky, they get resuscitated. I believe it happened. It was really dramatic sometime earlier this year. I believe it was in Cincinnati, and the gentleman survived. The heart goes into an arrhythmia, a bad rhythm. A normal heart functions in an organized manner. I mean, really timed, beautiful. But if the messages become disorganized, the heart contraction becomes totally disorganized, and its contraction becomes ineffective. So not enough blood is going up to the brain. What happens? The computer, the brain, just shuts down and they collapse. And if the heart continues that way, what will happen is that your organs in your body begin to shut down and the heart eventually stops, because the heart needs everything. It needs the neurological system. It needs the respiratory system to supply its oxygen. So if it's not working fine because its electrical system is gone haywire, those other systems can't support it, and eventually the heart just stops. It can stop too from a heart attack, which is extremely important. Some of you listening to me out there have coronary disease and you don't know it, and that's unfortunate. Now, I wish there was something that somebody can actually look directly in your eyes and say you've got coronary disease. It's fairly common. Now, you may go to bed and not wake up, and if one of those tiny coronary arteries I was talking about, and I'm talking about these things about 2 millimeters, if that, a millimeter even, if they shut down and they get clogged up with cholesterol and stuff, you develop a heart attack. Some people don't survive. 10% of people actually die instantly, and you may not wake up if you have that. Another thing is the big arteries that are connected to the heart, like the aorta. There's famous African leaders who have, just in recent years, have died when one of those arteries has ruptured. And happens even right here in America, in Europe, and a lot of these highly industrialized nations. So I'm talking about things like aortic dissection, where you can have a rip and a tear in an aorta. And guess what? One of the big risk factors, major risk factors for something like that is high blood pressure. So if you have high blood pressure and you're young, usually young males in the 30s, 40s, 50s, all of a sudden that pressure can cause a tear in your aorta and it ruptures and you drown in your own blood, and that's instant. Now, I've operated on a lot of those patients, and many of them who I'm still in touch with. They're just lucky to be in a place that's near a facility that has the resources. Or you can rupture from another big artery in your abdomen called the aorta, the abdominal aorta. Just a continuation of the aorta in the chest. And that's the aortic aneurysm you hear about. If it ruptures and if you're not lucky, you drown in your own blood and you die.
I have to tell you this, Doc. You are one amazing guy. Your credentials, I'm sure if I were to read your resume, I'll take the whole day to go through it. Dr. Zama, what makes you so simple, even though you are so sophisticated in this thing? I mean, lots of people will, a lot of us Africans, you will show up at a ceremony and everybody will be lying prostrate for them for you to walk on them, but yet you're so simple. What is the secret? What is it that drives you to be who you are, Dr. Zama?
Well, it's the environment I grew up in, and I came from a very humble background, and my parents were poor, illiterate, subsistence farmers, and really poor. And but the one thing they taught me is to be respectful of everyone, and to never think I'm better than anybody. And I've embraced those values my whole life, and I believe them to be true. And also, the more that I've always had a love for knowledge, a love for learning, and a love for human service. And so when all that came together, it made me even more humble. And why is that? Because the more you learn, the more you realize you do not know. And gosh, if there's anything that can make you more humble, yes, I do cut people in half and put them back together, but I can tell you now, I can explain to you how the heart works. But at the end of the day, why does it do what it does? I can't answer it. I remember, if some of you who've read my book, in there, a case where I cut open this frog when I was a kid in Africa. I cut out the heart because I was a very curious kid. And I've always said, had I grown up here or I was born here, I would have been in a reformatory school, some of the things I would do to animals. But I cut the heart out, and I noticed it kept beating in my hand. So I ran in to my dad in the hut, and I says, why is it still beating? It's disconnected. And he says, well, that's the way God made it. Now, I've done thousands of open heart operations, and I do stop the heart to operate on it, and I jump start it. I understand the science and the physiology, but the marvel of how it works and how it's integrated in the entire body, and all these connectivities that I'm telling you, that everyday knowledge about them emerges and evolves, how the brain is connected to the intestines, how the colon is connected to your heart, and all these things are humbling. And so I can't be but who I am, and so I'm really a victim of my circumstances, and I'm not saying that to be derisive of myself, but to say that I embrace that, and I embrace my humanity and the humanity of others, because also I can't be who I am without the great men and women around me. My real heroes, I'm not one of them, obviously, but are the great men and women, the nurses I've worked with, the doctors, and many of whom I can't even touch the hem of their dress, if you want to put it that way. They're brilliant, beyond imagine. But it's what we all have to do, work collectively, because we're on this journey together called life. And each one of us has a vital role to play, and none is more important than the other. So the maintenance guy in my building is just as important as I am.
Wow. I'm going to have you say a last word before you leave the platform. But before I ask for that, I have to say, Dr. Zama, that your humility is infectious. Your sheer depth of knowledge in this thing, your passion, I have to say also, is disarming. Oh boy, lots of people are writing brilliant conversation. Dr. Zama will be coming. I'm so grateful to you, sir, that you promised to come and talk to us about blood pressure. It's killing lots of people, It's called a silent killer. And that description is not for nothing. Dr. Zama, before you go, what's your last word in 1 or 2 minutes, sir?
Well, remember, the only thing that you own is your body. The only thing you own. It's not your house, it's not the car, it's not the money in your bank account. And if you take care of your body now, it'll take care of you later. That's all I have to say.
And you say it so with such stunning clarity. Thank you, sir. Dr. Zama will be back. And ladies and gentlemen, my name is Divine Nche. People are writing back and forth, texting me. My Beatrice Moma, thank you. Extending special thanks to Professor Zama. When I'm off the platform, I'll let him know that he's watching you. I want to thank all of you who watched. Please, I beg you, if somebody missed the show for whatever reason, tell them to go on YouTube. It's also on the internet and watch it. This is just, if you have to pay to consult this guy, to sit before this guy who is like the Library of Congress, it'll cost you a great deal. I know what I'm talking about. I want to hope that we, in our small way on Chat Night Africa, have contributed to the health and wellness of all our followers. Go on Play Store and download the app. Just search Chat Night Africa, and you will see our app. Once you download it, hit the app, you get connected instantaneously. We are also on YouTube in high definition. Thank you for watching. In French, they will say, merci à tout le monde. Je vous aime. Mais il faut que je parte. I love all of you, but all good things have an end. Oh, before I go, let me thank my producer in Lagos, in Nigeria, Roger Full. He's a truckload of talents. Without him, we would not be doing what we're doing. I want also to thank the guy who donated this broadcast camera. It's because of your donation that we have this clarity of broadcast. We are so grateful to you. He wants to remain anonymous. Finally, I want to thank every other person who just came to watch this show. I appreciate you from the depths of my heart. Thank you. And this is how, on that note, I say goodbye. We will be bringing back Dr. Zama to talk exclusively on blood pressure. Thank you for watching. Now I go.
I'm coming back. I'm coming back. I'm coming to get down. I'm coming to dance, We're gonna dance, we're gonna get down, we're gonna party hardy, we're gonna boogie woogie, and when we jam, it's out of sight. This song right here, it's dynamite. I'm ready, I'm coming.